thought I'd come on here and tell you what my son and I talked about this morning. My mother, who died almost 4 years ago, had developed hydrocephalus and some cerebral atrophy. So hydro, water, cephalus in the head, cerebral in the head, atrophy, smaller. So her brain was getting smaller while water was building up in the ventricles of her brain and squishing it against her skull. She had developed some difficulty walking. She had developed some difficulty thinking, couldn't remember things. So not really an Alzheimer's thing. Her mother had died of hydrocephalus in 1978. Her sister also had hydrocephalus. She had a ventriculoperitoneal shunt placed, which improved her. So I was talking to her neurologist, neurosurgeon, trying to get him to do a ventriculoperitoneal shunt for my mother, and he wouldn't do it. Why? Because she didn't meet the Medicare criteria for having a VP shunt placed to eradicate her symptoms. So the last year or two of her life, she was unstable on her feet. She couldn't remember things. She couldn't think. You had to she didn't have dementia, but you had to kind of remind her of things. So that's how medical care works. And I was telling my son that if you do not meet the criteria for insurance, Medicare, Medicaid, whatever, you can't get treated. And so I don't think all doctors don't want to treat you. They can't. Unless you have a whole bunch of money. So my mother's surgery would have probably been $80,000. She didn't have that at age 79, I think, when I started talking about this. And I didn't have it. So she got not treated. That's not what she died from, but it certainly affected the end years of her life, last couple of years of her life. So that's how it works. I think doctors really want to treat you, but they can't. I told you I left medicine because you can't heal people. If you heal people, you get in trouble, or they wind up with huge medical bills that make them file for bankruptcy.